Hey everyone, Tony D with another In 10 Minutes. This time I'm going to explain in 10 minutes why universal health care basically won't work in the United States. It really doesn't work anywhere. It works for a while. Because like any other government program, initially it works, and then when there are problems, the first reaction is, well, it doesn't have enough money. See, if we had more money, then it'll work. So they give it more money. And then there's more problems. And so they ask for more money. And then there's more problems. And then they ask for more money. And on the cycle goes until there's no more money to give or the entire system just breaks down. Partly it's because bureaucrats have nothing to do other than ask for money. If you're a bureaucrat and you work in a government office and everything is going swimmingly and you're spending exactly to the penny of your budget and nothing has changed, well, good for you if you didn't ask for more money. But see, bureaucrats, they always ask for more money. Now you might argue, well, things go up in price, and they do. But you know, when you're working at a private company and let's say the cost of staples go up in price or tape or some office supply, the company then usually says, well, you got to make do with the staples we gave you or you have to find a cheaper alternative. So they might do that or they might give you more money if no other alternative happens. See, bureaucrats aren't going to do that. They're just going to go, well, the price of staples went up. Give us more money. We always use the staples and we always use tape. So there's no real incentive to find another solution for things. It's easy just to go, well, give us more money, because they'll get more money. If you spend your budget at the end of the year and then some, you can credibly argue our department doesn't have enough money. You have to give us more money so we can do our jobs. And most people, they don't see the government's money as their money, right? If you work in a private industry, everybody sees the money as their money. If you work in a private business, the guy who owns it definitely sees it as his money. That's why he's on his employees not to spend any money. That's why you're constantly yelling at the employees. Not yelling, but you're constantly worried that the employees are like skipping out. They're stealing your money. There's an incentive built in to keep the business to run efficiently. The incentives are reversed in a government program. There's no incentive not to spend money. So if you have a person who's got a genuine medical problem and they go in for test, there's no incentive not to give them 3 or 4 other tests they kind of don't really need. Because, well, we just have to be safe. Now, if you're a doctor or a patient, you might agree with that. But if that happens all the time and, there are no real reasons for those tests, you're just wasting a bunch of money, taxpayer money. I argued with someone online about birth control. So someone was saying, well, the government should give us free birth control. And that would be a disaster. And here's why. So condoms, for instance, are cheap and plentiful in the United States. You can literally get them almost anywhere. They come out of vending machines. Now, I'm not talking about the quality, but the quality is fine enough, but they're literally in vending machines in places in the United States, and you can buy them for very little money, like, a couple of bucks at most. And you can get quality ones for slightly, like another $1. That's pretty cheap. It's not going to get much cheaper than that. Same thing with, any other basic, birth control. If you say, well, now the government gives birth control out for free, the people who make condoms then compete to sell them to the government, right? And the winner would probably be like Trojans, let's say. Because they're, been around so long and everybody knows that name. So let's say they win. Well, they sell the government the condoms and they just give them away. So when you go in to get your condoms or your birth control, Are you just going to get one pack? Well, you don't want to keep making trips. So you get like 10 packs. Even though they might just sit in your closet and never be used or get so old that you throw them out and get more. Why not? They're free. And if the government gives you a choice between the cheap brand, the medium brand, or the super high-end brand with bells and whistles on it, are you going to take the cheap brand home? No, you're going to take the one with bells and whistles. So all the incentives get perverted the other way, and meanwhile, people just pour money into the system. So this is why in the UK, the NHS, the big problem there is they constantly got to give them more money. They're constantly running out of nurses and doctors. You're also basically putting price controls on the doctors and nurses. Now, we don't have those in the United States. If you become a doctor, you can make a ton of money. Yes, there are all sorts of regulations. The big thing with doctors is the malpractice insurance is sky high, and they totally have their issues. But it's not as nearly as regulated as, say, Canada or any place else, because those doctors have to work for the government and have to see those patients. And they have to see them for a certain price that the government pays them. And they can complain all they want. You can end up creating a system where the doctors end up dictating the price. And you might say, well, that's a good thing. Well, let me tell you a story. What we used to have in the United States in the early 1900s were called lodges. They were medical lodges. So if you worked as a coal miner or some kind of blue-collar job like that, you would join a lodge. And for 1 week's pay, you would throw that in to get a year's worth of health care. And they would pool that money together, all the coal miners, let's say, or a group of coal miners, not all of them across the United States. And they would create a contract with one doctor who would then give all the medical care to all the people in the lodge. And, he would use that money to have an examination room and the supplies and all that stuff. Now, you can argue that medical care back then was not as elaborate and blah, blah, blah. But it's proportionate. It's the same thing as now. You would have a situation in which doctors or groups of doctors could create stuff like that if it was allowed. The problem is, with those lodges back in the early 1900s, the doctors eventually started competing for these very lucrative contracts. So the price of their Medicare actually went down, and the doctors actually offered their services for cheaper. And a bunch of doctors got together and said, hey, we don't want to work for cheap, especially not for these blue-collar idiots. We're smart. We're educated. We're going to create something called the AMA. And they did. So they created the AMA, and they used their friends in government to help legitimize it and say, well, we're the AMA, and you got to get your license through us now. And we don't give licenses to people who work for lodges. And thus, the lodges disappeared almost overnight. And that's how the doctors destroyed cheap healthcare in America. So, if you removed all those regulations, for a while it would be chaos. And yes, people have problems. They get ripped off. There are unscrupulous people out there, even doctors. But you have that now. You have unscrupulous doctors walking around in a system in which, if you've ever been in a hospital and you've had a doctor who you've never seen before walk into a room with a clipboard and kind of look you up and down and then write something on a clipboard and leave, that doctor just made himself a bundle of money. This is what happened to my dad. He was in the hospital, and a doctor rolled in like that, looked at him for 30 seconds, and then walked out of the room writing something on a clipboard. Was that needed? Maybe. Maybe he's like such an expert, and he was able to look at my dad in 30 seconds and determine whatever his specialty was, he wasn't needed, and he was good, and my dad needed that because he's older and whatever. Or maybe he was just cashing in. Maybe he was doing that in every room, because why not? Why wouldn't you do that? If you get paid like $2,000 every time you do that, why wouldn't you do it? This is the problem with healthcare. There's no competition, and it's so overregulated. The people at the top benefit, and the people at the bottom don't. And if you put in universal healthcare, you're basically turning healthcare into the American public school system. That's what it would be like. It would be a mess. If you've ever been to an American public school, that it works up to a point, and then, by senior year, it's just people don't even treat it seriously. It's not even a real thing. People just cruise through. It's especially a joke now when you've got students who barely go to class their senior year because they know the school will never fail them, because nobody wants to bring these kids back and spend more money on them. Everybody knows that senior year in the United States is a joke. People barely go to class. They barely do anything. Even I was a college prep kid. We hardly did anything our senior year. It was easy. So you don't want to turn the medical system into that. You don't want to turn the medical system into place, they wait in long lines in other countries that have universal health care. And they don't have nearly the population as the United States. The United States has an insanely big population, for the most part. 350 million plus people, more, I think. That's a lot of people. Somebody was going on and on. I think he was from New Zealand. New Zealand has under 5 million people. Okay? So you got about the population of Los Angeles in New Zealand. So one could argue that you could maybe create a system that covers Los Angeles and make it work if Los Angeles was a country. But we're not talking Los Angeles. We're talking the entire United States. A place that has terrain and people as varied as the kind of people and terrain you have in Alaska and the kind of people and terrain you have in New York and Florida and Texas and Hawaii and California and Maine. So Montana, Idaho, desolate places like that. Pretty desolate. They're pretty empty. I don't mean desolate in a bad way. So you can't centralize that in the federal government. It'll be a mess. It'll be an absolute disaster trying to write regulations for how a doctor should see someone from Montana the same way they should see someone from New York City, right? Montana, you live miles away from everything. It could take you forever to get to a place. In New York, you just, there'd be a doctor on every corner. You just pop into a Uber and you'd be there in 10 seconds. So it's a different world there. And if you end up writing the rules more like people in New York, you're going to screw the people in Montana and vice versa. Or you're just going to end up wasting a bunch of money because the system won't be able to accommodate everything. When you have a system, you want it to be streamlined as possible so it works, so it continues to function. If you make it this labyrinthian thing that tries to cover everybody but fails for everybody, then everybody's upset. No one's going to be happy. I have a friend in Canada, and he had a relative who had to wait for his cancer treatments. You don't wait on cancer. And yes, the American system is way too expensive. It's way too expensive. I fully acknowledge that. I acknowledge that in the comments with the socialists I'm arguing with. And that's very true. But the thing is, centralizing it is only going to make it cheap for the average American. It's not going to actually make it cheap. It just means that the government's going to have to come up with the money somehow. And the way we pay the bills in America, in case you don't know it, is we print money these days. So we can't really afford to be in the Middle East and all these countries. We're just printing money to do that. So if we just start printing money to cover our medical costs, that's going to be really bad. It's bad enough we're doing it for the military stuff. It'll be even worse once we start doing it for the medical stuff, because the medical stuff is actually more expensive. The unpaid liabilities in Social Security will be enough to cripple us financially if we don't get a handle on it somehow. So the answer is not to take the system and centralize it in the federal government. The answer is to create more competition to drive the price down. And the way you do that is through getting rid of the regulations that we already have. So, for instance, Rand Paul in the Senate tried to pass a bill that would have allowed insurance companies to compete across state lines. That would have been a great thing because it would have forced all the insurance companies to lower their rates in order to gobble up all the money. But it didn't pass. So, this is the problem. They don't want it to pass because if it passes, then they're going to have to lower their rates and they'll make less money. So these are the things we need. We need competition and more freedom in the marketplace in order to accommodate people. Because if you drive the price of healthcare so low that almost anybody can afford it, the people who can't could easily be covered by charity. That would be the goal, to lower the cost so low so that on every street corner you got a little medical kiosk that could handle most things, and then if you got to go someplace worse, you go to a hospital down the road. So you got to loosen up the rules. So basically Walmart would probably hire a doctor and be able to take care of all the little things, and maybe going to the doctor there only be like $20, and you go and gives you your flu medicine, you're out the door, and 90% of the time you're on your way. And then if you get something serious, you go further up the chain. So that may not sound appealing to you. You may say, well, poor people, they wouldn't be able to go too far up the chain. That's the system we kind of have now. And we already have a situation in which the resources already outstrip the people. There are going to be people who just can't afford health care. There are going to be people, and I'm probably one of them, or you're going to just have to go deep into debt. And there's a call there. I mean, if you have a guy or a woman who is so unhealthy, smokes cigarettes, drank, is a drug addict, is just abusing their body in every way possible and never stops and is constantly coming in for care, constantly, and you're paying for that. Do you really want to pay that? Do you really want to keep paying for that for a person who lives on the streets and won't move into a place, even if you give them a place? That is not something we can afford to do. There are people like that. I mean, if you want to do it, all these high-minded socialists who claim to be for poor people, I ask you, what have you done for poor people? What have you done? Have you done charity work? Have you gone out in the street and actually helped people and given them money and said, hey, let me get you a place to live. You can stay at my place. Or, that to me is when you really care about the poor. This virtue signaling online like, all these Americans are uncovered, I care. You don't care. You don't care really. So you're perfectly willing to go out there, make some money, give those people some money, do what you need to do to help those people, if you really want to help them, if you really care. Otherwise, it's just posturing as far as I'm concerned. If you want to help, we need to lower the prices. And to lower the prices, you need competition. It's as simple as that. Those are facts. It's physics, the physics of economics. Learn it. Thank you.